Good evening. I hate to stop this great conversation. I'm so sorry to interrupt, but I want to just take a moment and say what a pleasure it is to welcome you here all this evening. I would say it's a pleasure to welcome you here anytime, right, and always. But this evening, it really has a special meaning for us, and it's special because of what it represents, and that is the launch of our community-based palliative care program. I'll take that. So our program is called Kaleidoscope, and it's a service that will be providing home-based palliative care for people with serious advanced illness. And home-based palliative care, for those of you who may not know, is really a game changer in the community. And it's a game changer for several reasons. There are numerous studies that we know of that community-based palliative care is associated with favorable outcomes because patients experience better symptom management, they have improved emotional well-being, and enhanced quality of life. In short, it's better care for people at home. It also helps to rectify healthcare inequities by improving access to care. We just talked about access to care with a few of our guests this evening, and what that means, right, for people to be able to have better access. Sometimes transportation is an issue that isn't an issue if we're bringing the care to you. And coordination of care is also improved because it helps to connect patients with and their families with services that are helping them to live in their home, right, which is where most of us want to be all the time. These are just a few of the reasons why we want to bring home-based palliative care to this community and take this opportunity this evening to introduce you to Kaleidoscope. So what I'd like to do, without further delay, is to introduce our Chief Medical Officer, Dr. Eisner, and she's going to provide some of the unique details of our program and also introduce you to the Kaleidoscope team. So Dr. Eisner, please come on.
Good evening, everyone. Thank you so much for coming this evening to learn more about our Kaleidoscope community-based palliative care program. When you think about a kaleidoscope, I think everyone in here has a smile on their face when they think about turning the dial on the kaleidoscope and seeing the beautiful images. And in the same manner, we think of our patients the same way. Each one is unique and beautiful in their own way, and no two patient life situations, medical conditions, symptoms, or social stressors are the same. And in the same way, every time the kaleidoscope dial is turned, another unique image is seen. The multiple images in a kaleidoscope also represent the multi-dimensional and multidiscipline approach that we take to our Kaleidoscope palliative care program, which is unlike any other in the region. So what does the right care look like? First, let's paint a picture of a typical palliative care patient. There are a lot of myths about palliative care. One of them being that palliative care is hospice, which it's not. Palliative care is not hospice, but hospice is a form of palliative care. Right now, each one of you in the room either knows somebody, maybe their neighbor, maybe it's a loved one, maybe it's a spouse, maybe it's a child, maybe it's someone that you've run into lately who would benefit from palliative care. What does that person look like that's in your life right now? It could be somebody who's been in and out of the hospital once or twice this year. It could have been somebody who's fallen. It could be somebody who is weaker and is now needing rehabilitation after a hospital stay. It's usually somebody with multiple medical problems. Maybe the person you're thinking about has lung disease or heart problems. Something's wrong with their kidneys and they're requiring dialysis. Maybe they have a neurological condition. This person that you think about, you also worry about them because you know that it might be one or two hospitalizations that might tip them over the edge. So let's talk about what the right care looks like. And to best illustrate the beauty of our program, someone in our audience has offered to be our model palliative care patient. This is Cheryl. Cheryl entered our palliative care program. No, not really, but pretend. When her doctor thought she might benefit from it. She has multiple medical problems. As you can see, she uses a cane to walk with, and some of her joints aren't working real well. She has a lot of pain in her joints right now. She's had both hips replaced. She's had neck surgery. She's had back surgery. And so she has a lot of pain from these things. Sometimes she feels down. Sometimes her mood is down because she feels discouraged and overwhelmed. She has to go to the doctor a lot. She recently had a heart problem and needed an EKG, and luckily, the doctor didn't think she needed to go to the hospital, but it really scared her. Her husband is feeling overwhelmed too. He's taking her back and forth to the doctor's visits, and he could really use some resources. He's not getting around very well either, and maybe Meals on Wheels would be something that they would need. So Cheryl called into our program, and she reached Peggy Catchings and Cindy Vasta, if they could come up. Cindy Vasta is our referral specialist for the palliative care program. Peggy Catchings is our office manager in our palliative care clinic. These lovely ladies are answering the phone calls from 8 to 5 and bringing all of our patients into our Kaleidoscope palliative care program. And Cheryl was introduced in our program and got in within several days of her phone call. Because Cheryl was having pain, she really needed to see one of our nurse practitioners in the Kaleidoscope program. Kathy Bennett, could you come up? Kathy Bennett's been a nurse practitioner for our program with Center for Hospice Care for, 10 years? 10 years. Kathy Bennett helped Cheryl with her pain that she was having in her neck. She was able to prescribe her medications to help with her pain and her anxiety and her sad mood symptoms that she was having. In our palliative care program in Kaleidoscope, the nurse practitioners, and it's Kathy Bennett, helps patients with symptoms that they may have, whether it be pain or anxiety, shortness of breath, nausea, depression, insomnia. She's also having conversations with patients about end of life, helping with goals of care conversations, helping with goals, advanced care planning, in the setting of Cheryl's home where she doesn't have to worry about making a decision quickly in the hospital. Kathy Bennett also educates patients on their disease processes and what Cheryl could expect when her arthritis gets worse, maybe when her heart gets worse, educating her about what to expect if she has to go into the hospital, and improving quality of life by managing her symptoms. Like a kaleidoscope, a human being is not one-dimensional. Cheryl is not just a physical being, she's also emotional and spiritual human being. Because Cheryl was also needing help, as well as her husband in caregiver support, Jessica Williams came to visit her. She's our community health worker. Jessica continued the goals of care conversation with Cheryl for decisions she just quite couldn't make yet. She addressed the caregiver burden on her husband and helped him with resources in the community. She helped her to improve Cheryl's psychosocial well-being and decrease stress on the family by referring to support groups and telling her husband about resources in the community. Because Cheryl wasn't able to get around very well, she wasn't able to go to church anymore on Sundays. This was very hard and difficult for her. She was able to watch the church services on TV, but it just wasn't the same. She really wanted somebody to connect with her spiritually, maybe pray with her, maybe discuss what was in her heart. So Larry Rice came to visit her. He offered emotional support and attended to her psychosocial needs. Kaleidoscope has a team of chaplains to address these spiritual stressors that patients have when they have advanced illnesses. Cheryl's husband was finding it difficult to run errands, to go to the grocery store. He also liked to play tennis once a week, and he wasn't able to leave the home. So Christiana offered her services. Kaleidoscope has volunteer services that help with monthly tuck-in calls. They offer respite care for loved ones that have to go run errands. And we also have pet therapy. One evening, Cheryl's pain was really out of control, and it was after 5 o'clock. She didn't really know what to do, but she knew that she was told that the Kaleidoscope program offered 24/7 access to care. So she called into triage and spoke to Chrissy Madlam. Chrissy offered to calm her fears. Chrissy talked with the nurse practitioner, and the nurse practitioner gave her advice that she could take an extra pain medicine overnight. This relieved her fears and anxiety and helped with her pain and got her through the next morning until the nurse practitioner could see her. Being able to call into triage in the middle of the night to alleviate some of these symptoms decreases hospitalizations. Now think about that person that you were thinking about in the beginning of our conversation. The person that you know that could benefit from this program. Just looking behind Cheryl, you see this team of people to help her. And imagine what a wonderful thing that would be for your loved one, for your patients that you refer, for our community. Thank you, guys. Thank you to the Kaleidoscope team. Let's talk briefly about the right time. It's never too early to refer a patient to Kaleidoscope. The sooner the better. The American Society of Clinical Oncology guidelines state that anybody diagnosed with advanced cancer should be referred to a palliative care clinician within 8 weeks of diagnosis. That's not 8 weeks before death, that's 8 weeks after diagnosis. Remember that patients can continue to receive traditional medical care at the same time that they're receiving palliative care. Palliative care can begin at the time of diagnosis and continue of any advanced illness and continue at the same time the patient is getting treatment for their advanced illnesses. Our Kaleidoscope palliative care program sees patients in their home, wherever they call home. Not just their home, but if they're in a nursing home, assisted living facility, group home, we will see them. Our Kaleidoscope mission is to give the right care at the right time in the right place. But most importantly, it's the right thing to do. We heard hospital administration tell us what they need. We've responded to the community's needs. We've listened to the physicians in the community. We have a member of our medical staff, Kathy Bennett, who has been waiting 7 years to see the palliative care arm of our organization flourish. We have a lot to be proud of, and there is no other program like this in Michigan or the other 9 counties that we serve. I want to give a special thank you to John Mastrojohn, our CEO. His vision, insight, and encouragement in helping us to create this community-based Kaleidoscope program has been amazing. Thank you, John. We are so grateful to those here today for your interest and support of helping the Kaleidoscope program succeed and grow. Thank you.
You can't thank me because I'm going to thank you. I really want to give a shout out to Dr. Eisner and the team. Dr. Eisner and her incredible leadership has really gotten this program from concept to reality. And you just met the members of the team in a very unique and creative way. So thank you for that. And we're just thrilled. So thank you, Dr. Eisner. Thank you to the entire team. And thank you, Mrs. Meisner, who is our star patient this evening. So thank you. I also want to just take a moment and thank all of our donors. Our donors have really helped to make this launch of palliative care what it is. And we are especially thankful to the Judd Layton Foundation, and in particular to Kate Mullins, who was the executive director of Judd Layton. And I don't think Kate was able to be here tonight, but nonetheless, we're still going to give her a shout out because we're so appreciative of them and their generosity to the Center for Hospice Care. So thank you for that.